Okay, so what is your name, age, and gender, and how do you think these factors have influenced your path in this profession?
Um, Q show, 56, male. How did that affect my career choice in this? It didn't affect my career choice. It was just because it's a male or female can be in this position, but it has been predominantly female in the past, but more men are in the profession.
Okay. Can you describe your current profession and how it connects to exercise science or kinesiology?
Uh, I'm I'm a registered nurse and I work with special needs kids. Uh, a lot of kids that aren't able to take care of themselves. They either have a congenital condition to where they have problems breathing and they need a ventilator to help them breathe. They can't eat by themselves or take medicine by mouth, so they'll have a feeding tube and they're not mobile. So I have to help them move. And a lot of times they will need physical therapy during my shift.
Okay. So, how long have you worked in this field and what changes have you seen in the health and fitness industry over time?
Um, I've been in this field for about 14 years, and there's been advances in equipment as far as like prosthetics and devices that help kids, like tablets and software to help them with their speech or programs that they can, if they can't talk, verbally talk, they can use a device like a pen to point something on a pad, or they can, the actual computer or pad can recognize what they're looking at and they can communicate that way. So a lot of advances in technology.
Okay. So, where do you primarily work? Like a clinic, gym, school, rehab center? And why did you
I
choose that environment?
I used to work in the hospital, but now I work in outpatient, where the person the patient's home after they get discharged from the hospital, where they're able to go home, but they still need care. And I chose this because you get better interaction. You get more interaction with the patient, more satisfaction of seeing them get from one point to another, as opposed to just being swamped at the hospital and not. You don't. Your time is limited, so you don't get to give them the best care. You just give them what they need, what you can at the time. So just better patient interaction
Mm,
and
okay.
care.
So, what kind of training or certification are necessary for your job?
We have to have a nursing degree. You have to have experience at a hospital. You go through a internship in a hospital floor. I got my internship in the ICU, and then for the job that I'm doing right now, I work with a lot of respiratory patients. So I had to get training on a ventilator. Usually in the hospital, the respiratory therapists are the ones that deal with the ventilators, and the nurses don't touch the ventilators at all. But in this role, I'm the only person that is able to handle the ventilator or control the ventilator. So if something goes wrong, then I'm the only person there responsible for it. So I had to learn how to be a respiratory therapist, how to give breathing treatments, and how the vent works. So we have to get training with that.
I see. So, who or what inspired you to pursue this career? And what do you enjoy most about your job?
Um, I would say my dad inspired me because I saw him as getting older and I wanted to be able to help take care of him in his old age. And then it was a career change. And what I get most out of my job is that satisfaction of seeing the patient going from point A to point B, and even if they don't go far, there's something in the day that you can get some joy out of with your patient, even though they're in a very tough situation. So the kids are very resilient, and they even though they can't play or move or run or jump, sometimes just little things can make their day.
I see. It's very cool.
Not a patient interaction satisfaction.
Okay. And how does your work impact like your health?
I would say it could impact it positively or negatively because positively because you have the knowledge of what you should do to be healthy, because you have to help a patient be healthy, but negatively because you're busy and then you don't necessarily take care of yourself all the time.
Okay. And so, how has your career influenced your personal health and lifestyle, like outside of work?
I would say I'm more conscientious of my health lately than just an average person. So I take more charge and more effort into being healthy, eating, and a clean lifestyle, clean lifestyle as far as eating clean food and clean lifestyle in sleep and getting plenty of sleep and exercising.
Okay. And final question is, what advice would you give a student interested in like kinesiology or someone who wants to take the same career path as you did?
Well, I would say if anybody would want to follow that career path, if they have a passion for helping people, they'll be great at it. They just have to go through the process of getting trained and educated and getting certifications.
Okay. Thank you so much for your time.